Our next speaker is Dr. Teresa Liu-Ambrose, and what we have been talking about so far is, what's going on in the brain with this disease and so on. Dr. Nygaard implied that maybe some changes can occur in the brain with the intervention. And now we're getting to, what is the point of that? Is there a change in function? Is there a change in people's abilities? And Dr. Liu-Ambrose is going to be talking about the impact of exercise, a most important intervention. Then the side effects are just muscle tension.
Thank you, Dr. Beatty, for the kind introduction, and good morning, everybody. And just want to wish Happy Lunar New Year to those of you who are celebrating. It's the Year of the Rooster. So for those of you who've come to the past forum, you have heard me talk about the potential of exercise on promoting brain health within the context of healthy aging. And today what I'd like to do is more focus on what we know about exercise in terms of benefits for those with mild cognitive impairment. And this slide in various form has been shown numerous times this morning, whereby it really is demonstrating a continuum of cognitive function within the context of normal aging as well as within the context of disease course. And what I'd like to do really today, or at this point, is focus on what do we mean by mild cognitive impairment. So this is a clinical state that resides between normal cognition and dementia. And basically, for these individuals, typically they do feel that there are some changes in how their memory or reasoning abilities are as compared to in the past. And if we did assess these individuals, we can pick up some deficits. However, they're still functional, meaning that they're still living independently and managing fairly well at home. So why do we care about this particular state of cognition? Well, we do know that people with mild cognitive impairment are at greater risk for developing dementia over time. However, we also know it can be a transient state, meaning that some individuals who are diagnosed with MCI can also revert back to normal state in sort of subsequent years. And so as a result of that, there's a lot of interest to gaining understanding how exercise may potentially have benefit for these individuals because, again, they are at greater risk, but they also have the potential for reversing. And currently, the definition for MCI has 4 components. One is subjective memory complaint, meaning that if we spoke with individuals and asked them, are you concerned about your memory or general cognitive abilities, they would answer yes. 2, if we did assess them using standard neuropsych battery, we would also detect certain deficits. Third is that they're still functioning fairly well and independently in their own homes. And as well, the fourth factor is that they're not diagnosed with dementia. Now, as I talk about the evidence, I want to emphasize that when we look at the evidence to support the notion that physical activity has benefit for brain health, typically the evidence comes from 2 types of studies. One is what we call cohort studies, and these are studies whereby we observe people, we measure them, but we don't intervene, we don't give them exercise recommendations or specifically exercise classes. We just simply observe them over time. Typically, these studies are good in giving us evidence of association, meaning that there's a relationship between physical activity level and how people perform over time in terms of their cognitive performance. However, these type of studies do not give us good evidence of actual causality. Okay, and so for today, what I'm going to be focused on is the second type of study design, which is intervention studies or randomized controlled trials, whereby in these type of studies, we recruit people, we specifically give them an intervention by chance, so it's half of the individuals or a third of the individuals may receive one specific treatment, and then the rest of the groups get different treatments, and how they get assigned to these groups are purely by chance. We measure them before the start of the study and at the end of the intervention, and we basically compare how people have changed over time. This particular study design gives us more robust evidence of causation, such that does exercise specifically have impact on your cognition. And I want to highlight that just because I know when you look at newspapers or media outlets and such, sometimes it's really hard to filter the quality of that evidence. So I just want to emphasize my focus is on randomized controlled trials, and that's really what my research program focuses on as well. So what is the potential of exercise? First, I like to start off with focusing on aerobic types of exercise, and these are basically any physical activity that increases your heart rate, so such as running, swimming, cycling. Okay, and the first study I just want to highlight is among otherwise healthy older adults, so not individuals with MCI, and it was done by my colleague in Pittsburgh, and it's a really nice study where it's a large randomized control trial where they recruited healthy older adults and randomly provided half of the individuals with a 3 times per week walking program, and the other half received also a 3 times per week type of exercise classes, but it wasn't walking based, it was just stretching, balance exercises, very light types of exercises. And what they did is measure their cognition before and at the end of the 12-month period. And what they found is that this type of program could actually improve your memory and also literally reverse the age of your brain by upwards of 2 years. So in this study, they did acquire brain scans of the participants. What they found is that in general, after 12 months of training, the hippocampus, which is sort of the memory center of your brain, actually increased or grew by 2%. So with aging, and especially with Alzheimer's disease, the hippocampus actually shrinks. It's like a muscle. If you don't use it, you lose it. It shrinks over time. And we actually know statistically after the age of 55, your hippocampus will shrink upwards of 1 to 2% per year. And here in this study, what they actually found is after 12 months of walking, again, 3 times per week at a moderate pace, you can actually increase the amount of hippocampal volume by upwards of 2%. Hopefully that is pretty impressive to all of you. That's like reversing your brain age, right? Because generally if you didn't do anything and went on with your usual sort of activities, the hippocampus will already be shrinking after age of 55. And here in this study, they're actually showing a reversal of that. So that's among otherwise healthy older adults. Now, for those individuals with MCI, we actually found a very similar benefit of aerobic-based type of training, whereby among older women with MCI and training them for only 6 months and twice a week, we actually also saw increases in memory performance as well as increases in hippocampal volume. For memory, there's many different aspects of memory. Here in this particular study, we saw improvements in both spatial and verbal memory. So for verbal memory, we basically gave them a list of 15 words repeatedly and basically quantified how many of those words they can retain over time. And then for spatial memory, it's very similar to this particular task, whereby they saw different objects appear spatially and disappearing, and then they had to basically remember the sequence by which each object appeared in space. So that's spatial memory. So in this particular study, we found improvement in both spatial and verbal memory, as well as evidence that there was an actual direct impact on the brain itself. Furthermore, this year, we also published new findings whereby we found, again, 6 months of aerobic training in people with MCI, primarily due to small vessel disease, meaning that when we look at their brains, we can actually quantify that there is disease in the white matter components of the brain. After 6 months of training for 3 times per week, we found yet again there was improved memory performance as well as reduced blood pressure. Now, reduced blood pressure may not seem that significant to many of you in the context of exercise, because you do know that one of the hallmarks of exercise or being physically active is better blood pressure regulation and better insulin regulation, etc. However, I'm not sure if all of you do recognize is that with blood pressure and also with insulin regulation, this regulation of those components can actually have a very negative impact on your brain health over time. So one of the hypotheses as to why exercise is beneficial for the brain is simply the fact that it keeps you physically healthy, simply from that perspective. I know you heard a lot about pretty exciting and novel theories as to how we can treat neuropathology within the brain, but if we just take a step back, we do very much have to recognize when you keep yourself physically healthy, you're providing a very physically healthy environment for your brain, right? Because you're ensuring that there's proper blood flow, nutrients being delivered to the brain. And so in this context, we actually saw that when we did reduce the blood pressure, there's an association with improved cognition within this cohort of individuals. And again, just to emphasize that this walking program was of moderate pace, meaning that they weren't running, they weren't exhausted, they were simply walking at a pace where they can still carry a conversation with their friend or colleague, etc., but it was a bit of a challenge. So that's the intensity we're talking about. And also, just to show you a picture of actual participants for this particular study, I want to emphasize here that hopefully what this picture is showing you is that there is an array of individuals. So we have people, we have some individuals who look pretty, otherwise, I can't get the, here. Otherwise, pretty functional. But we also had individuals who are much older and were much more physically frail. And yet we were able to train them and to also observe a benefit for them. And the other pretty exciting evidence we're now generating and is under review is that in the same study, we did quantify brain function using functional MRI. And we actually found that for those who participated in the walking program, it would appear that their brain actually became more efficient. So what does that mean? So generally, when we think about someone who's really efficient, that means they're pretty productive. It doesn't seem that they take as much time or as effort to complete a task. There's a notion out there now thinking about how brain could compensate as well as becoming more efficient. So efficiency or neuroefficiency could be defined as having the same level of cognitive performance, but your brain is not working as hard in such that it doesn't require as many regions or as much effort from the brain to allow you to perform a task at hand. And what we found essentially is after 6 months of training, and what this bar graph is showing here, this is actually demonstrating the brain activation of those individuals who did not receive the walking program. And this represents the change in brain activation for those individuals who did receive the walking program. And as you can see, for those who did not receive the walking program, over time, what's happening is that they were actually recruiting more of their brain regions to perform the specific tasks we gave them. In comparison, for those who received the walking program, they were recruiting less. So that seems counterintuitive, but that's actually, I would say, an evidence of neuroefficiency, because at the performance level, guess who did better? The walking program participants. So the participants in the walking program were actually doing better in terms of the performance, yet when we scanned their brains during the actual task completion, they were using less of their brain to actually perform the task at hand. So that's what we would call neuroefficiency. So we're pretty excited about that because that hasn't really been demonstrated previously. Okay, and then now I want to segue the conversation to talking about what about other types of exercise. So let's say you have arthritis or you have some mobility issues, and it might be difficult for you to walk continuously for approximately 40 minutes. Well, the good news is that there are other options. We certainly have done studies to suggest that lifting weights or strength training would have equal benefits to aerobic-based type of exercise for your brain health. So in 2014, we demonstrated that after 6 months of strength training for twice a week among older women with MCI, we also saw similar benefits for both memory and executive functions. Moreover, with neuroimaging, we demonstrated that resistance training can also have impact actually on actual disease progression, meaning that when you do lift weights on a regular basis, it can curtail the amount of progression in the brain in terms of underlying pathology, specifically relating to white matter disease. And just to note that white matter disease in the brain not only has relevance in terms of cognition, your risk of developing dementia, but also developing mobility disability. With aging, I would say the two greatest fear for most individuals is developing significant cognitive issues, but also losing your physical ability to get around and do what you want to do. I also want to highlight that most recently in 2016, my colleagues in Australia also replicated what we've previously shown in terms of benefits for lifting weights. They also found among older adults with MCI that strength training can improve cognition, reduce disease progression within the white matter, and also actually increase cortical gray volume in the posterior cingulate cortex. Now, I want to quickly segue, because I don't have a lot of time, to talk about what is the current evidence in terms of exercise for individuals with dementia. So everything I've talked about to date has been really solely within the context of people with MCI, but without dementia. The current evidence is still emerging, but a really good source of what we know currently would be the Cochrane Review, which is really an extensive effort in summarizing all the evidence and most specifically randomized controlled trial evidence as to whether a type of intervention can have an effect. And the most recent conclusion is that of 17 studies that were included in this review, that there's no clear evidence of exercise on cognition for individuals with dementia, okay? In part because the studies are generally of low quality and also quite variable in terms of how they measure cognitive function and also potentially the duration of the exercise training or the frequency. However, there is evidence to suggest that exercise could improve activities of daily living in those with dementia. Now, I want to pause for a second. So in some ways, this may seem like a very negative news, right? Because there wasn't good evidence to suggest that exercise potentially could improve cognition in those with dementia. But is the ability to perform better in your daily activities any less important? To me, that actually might be more important, right? Because a common question I get asked is actually this. So you've demonstrated they have improved memory or executive functions, but how are they doing every day? And very often we don't know that answer because we don't quantify or measure it. And in this particular review, what they're actually suggesting is that even though we may not see differences in actual cognition, people are actually doing better in terms of how they function on a daily basis. And I do think that is important to know, and in many ways very supportive of exercise as part of the management of those individuals diagnosed with dementia. Oops, sorry. And then the last bit is that this is more from cohort data. Now, I want to highlight the notion that it doesn't take a lot to have benefit potentially for your brain health. So this is just an example. One particular study, it was a cohort study over 9 years where they follow people at baseline and 9 years later, and in terms of both their cognition and using neuroimaging to quantify brain volumes. And what they found is that if you actually walked approximately 1 kilometer per day, you can actually maintain not only your brain volume, but also reduce your risk of developing cognitive impairment over time. And just to really break it down, what does 1 kilometer look like per day? Well, if you're living in Vancouver, that's approximately 10 city blocks or 2.5 times around a standard track. So really trying to push the fact that we're not talking about running the Boston Marathon or really having to sort of exert yourself where you're at the risk of injuring yourself physically. And also, too, just to highlight, there was a publication that came out in the LANCET in 2015 that really supports the notion what you do every day really does matter. So this was a 2-year study, not only on exercise. Exercise is one of the component of the intervention, but also included managing your diet and your cardiovascular risk, and included roughly around 1,200 individuals. So it's one of the largest RCT of lifestyle strategy currently. And what they found is after 2 years, those who were in the multimodal lifestyle intervention group did have a lesser risk of developing cognitive decline over the 2-year period. And as well, just a few advice, if you're not active now, these are some of my suggestions. One is to really just build bouts of activity in your daily life, and you all here have heard that advice for sure, such as, parking your car 2 blocks away and walk to your destination. I want to be a little bit more specific, whereby I'm trying to give you advice as to you can build in components such as strength training. So, for example, if you are waiting for your dinner reservations, walk around the block, around the mall while you're waiting for that. But in terms of strength training, this is, I think, where most people are quite challenged. So I would suggest if, let's say, you're watching TV during a commercial break, get up from the chair and sit and get up again and repeat. And again, this may not sound like a heck of a lot, but if I may, just to take 10 seconds of your time, if you can push your chair back just a little bit and try it, okay? I want you to tell me how you feel after you do 10 sets of those. So all the way up and all the way down. Keep going and tell me how you feel afterwards. Okay, I'm out of time, but just to hopefully highlight, you do feel something, right? It sounds simple, but it actually does provide you a stimuli. So really, no excuses. And then the second piece is that if you still have to get yourself motivated, reverse psychology, think about reducing your sitting and lying down time just to 23.5 hours. I trust that will give yourself a bit of a motivation to be a bit more active throughout the day. So these are the overall conclusions. And then as well, there's an app to motivate you if you like. Most recently, we collaborated with a number of consumer groups and also Apple Research, and there is an app called Walk 10 Blocks. It's quite user-friendly and actually was late, as of just 2 days ago featured by CBC. It really is just trying to motivate people to literally take small steps toward physical activity on a daily basis. So if you are interested, try the app. It's free, and that would be great for us in terms of getting feedback on its usability. And thank you, and sorry for the time.
Thank you very much, Teresa. I think we have some good hints, and I think everybody was really ready to have a little exercise at that point.